I always decide to come to Turkey for all my surgeries just because, first of all, the quality is amazing. They literally always come pick you up with a private car. They take you through step to step. You don't even have to know Turkish or anything. Like, there's going to be translators all the time. Second of all, the quality of the doctors is also great. And third of all, it's a lot cheaper than in the UK or in the US. And if I have to be honest, the hospitals in the UK look ratchet and very disgusting compared to the ones in Istanbul and Turkey in general. So, yeah.
Yeah, the hospital quality is very good in here, right?
Right.
Yeah, I heard about it. How did you decide to come clinic-wise? Where did you find us?
Actually, a recommendation from one of my friends. She's surgery savior, and she basically handles a lot of, well, she's a business, and she helps a lot of surgery dolls when they come to Turkey. Like, she offers them nurses, and so I always ask her who are the best doctors, and she recommended me clinic-wise and Dr. Ersin. Oh my god, it's beautiful. Perfect, thank you. Yes. Bye guys. Oh, look at this. Oh, wow, look at all the marble in here. Oh, nice. The toilet. Oh.
Surgery day!
Yes, hi guys! I'm very excited to be here. I'm in my hospital room. I'm also in my gown, and I'm ready. It's 7 a.m. in the morning, but for some reason I'm super energetic, which is weird because I'm usually very sleepy.
So, are you nervous?
No, not at all. I'm very trustworthy in the hands of Dr. Ersin. That's why I chose him. He's one of the best. He literally does everything so safely. And also, I'm very trustworthy of the staff in general because I have no reason to be nervous. Like, I've been treated like a king here, so yeah.
How is your hospital room? Are you happy about the room?
Yes, very happy. As you can see, I have my own little room. It's very nice. Super clean, by the way. I also have a lovely bathroom. I think you will be able to see it later, but it's literally like a Hojo's bathroom. I have my little toiletries, shower, everything.
Well, Matteo, as I checked your medical history and your blood test, everything looks good. We don't have any obstacle about your operation.
Perfect.
But for one more check, for safety reasons, I need to ask the same questions to you. Sorry for that.
Right, of course.
We heard all these questions a lot of time, but just for safety reasons and one more check, in order to not to miss anything, I will ask the same questions to you.
Right.
And then make a check for your body, make your markings, and you will be ready for the operation.
Perfect.
You are the first patient of today.
Ah, great.
And after the market, we will be meeting with in the operation room in about half an hour.
Perfect.
Okay. And your operation will be done under general anesthesia. It will take about maybe half an hour up to 1 hour time for me. I will do all the things you need.
Perfect.
And then you will be waked up. You will come to your room. We will follow up you for a couple of more hours, but you will not need to stay at the hospital,
Right, of course.
as this operation is not a big operation.
Yeah.
When you feel yourself good enough, and I will come and check on you, you will be able to discharge from the hospital.
Perfect.
Okay.
Yeah.
That's the plan for you. And now let's come to the questions.
Okay.
How old are you?
I'm 21.
Okay. Do you have any kind of disease? Any blood pressure, diabetes, asthma, sickle cell, anything?
No.
Do you use any kind of medications? Any
No.
pills, any vitamins, supplements? Anything
Well, I
else?
stopped taking all of them before surgery, so yeah.
Okay, that's good for us because some of them may cause some kind of bleeding
Right.
or more bruising than usual.
Mm-hmm.
And so it's a good idea to start them 1 week before the surgery. And did you have any kind of surgery before? Any surgery?
Yes, many.
Okay.
Do I need to say them all?
Let's talk about them.
Okay, so I had 3 nose jobs.
Okay,
A
when was
temp-
the last one?
My last one was 7 months ago.
Okay, that's good.
I had a temple lift, buccal fat removal, hair transplant,
Okay.
acanthopexy,
Okay.
veneers. I don't know if that counts. Veneers.
Veneers, okay.
And yeah, that's it.
Okay. Did you have any kind of problem about the general anesthesia?
No.
Okay, that's good. Did you have any history of gaining too much weight and lose it?
No.
Okay. And do you smoke?
No.
Do you have any kind of allergy to anything?
Mm.
Okay, that's good.
Yeah.
You look like you're a perfect patient for this kind of surgery.
I don't even drink.
Okay,
So.
okay, that's good. It doesn't matter for me.
Oh, okay.
But drinking alcohol is not recommended for the last 3 days
Right.
prior to the surgery.
Okay.
And that's it.
Right.
Okay. You don't have that much big problem.
This one is
Yeah.
more than the other one.
I can feel the
Right.
gland underneath. And you don't have that much fat underneath.
No, I think it's most just glands.
Yeah, it's mostly the gland.
Mm-hmm.
But I will need to do just maybe a little bit liposuction
Yeah.
in order to make more harmony
Perfect.
on your breast and remove the excess gland tissue underneath of your nipples with a small incision underneath of the nipple.
Can you remove it all?
No, it's not a good idea because
okay.
if I remove all the gland tissue, your nipple may be depressed.
Oh, okay. Okay, yeah, that's
so
fine.
for that reason, we have to leave just a little bit
Right.
gland tissue inside in order to keep the nipples out. Okay.
Okay.
This is the more natural.
And so will they look flatter then?
They will look just a little bit flatter than here is better, here is just a little bit worse.
Yeah.
But we will try to make them more even and more symmetrical than now. Like I told you, the biggest problem is about the gland.
Yeah.
I need to remove them surgically with a 1 centimeter
Perfect.
incision from
Yeah.
here.
Yeah.
And I will do this liposuction procedure also from the same incision exactly.
Perfect.
Okay. I will do just a small lipo here
Thank you. I would love that.
in order to make more defined
Yeah.
muscles for you.
I would love that. Yes.
Yeah. Our incision will be just okay.
Yeah.
Underneath of the nipple and do some lipo here
Perfect.
and remove the excess gland tissue, not all of it.
Okay.
It is not appropriate in order to not to make the nipples depressed
Yeah,
and
no.
make them completely natural. Okay.
Perfect.
And the upper part of the breasts are no man, you don't touch.
Okay.
Okay. Here is no touch area.
Perfect.
Okay. They will be looking like now after the operation also. Okay. We are done with the marking.
Perfect.
Later.
Matteo, we are in everywhere.
Yes, already.
Hi, doctor. Let's see you again.
Yeah, it's good to see you again also. So we did your operation yesterday, the gynecomastia thing with general anesthesia. It was a short operation and you did stay just a couple of hours at the hospital. Then we did discharge you when you feel yourself strong enough. And today is your checkup day. We will open all your garments and your dressings and you will see yourself for the first time after the operation.
Oh, okay.
How you feel right now?
Yeah, I honestly feel great. Like I was expecting more pain. I wouldn't say it was painful at all.
Yeah.
Just discomfort. The most painful part I'd say is just like the back pain. But apart
Okay.
from that, I can move well. Yeah.
Okay, how was your night yesterday? Did you sleep well?
I did sleep well.
Okay.
I was like sleeping like this, standing up, because
Okay.
I couldn't move that much. But yeah.
Okay, that's good. Now, it's time to make a checkup for you.
Perfect.
And to see your new
Okay.
situation. Okay? Okay, Matteo. It's the big time right now.
Yes, I'm
How you
excited.
feel?
I'm feeling great. I'm excited to see them.
Okay.
Not puppy anymore.
I will open all your dressings and
Okay.
garment. I will do no pain. Don't worry about it.
Okay.
And you will not have that much dressings anymore.
Mm.
I'm opening the thing very gently. And
Oh, there's no blood.
no blood.
Oh wow.
Okay. No, just
Oh,
leave
okay.
it right now. Like that. Now I will open the tapes.
Yeah.
Yeah, just small tapes. We'll open them. Oh, yeah. You may feel just a little bit. Okay. You have some foams. They are done. And your incisions. I just
Oh
like
wow.
that.
Look at them.
You look so good with almost no bruising.
Wow.
Yeah. And everything looks good. You have no problem. You have almost no anymore gland tissue.
I
on
see
both
that. They're
sides.
flat.
Yeah. The left one was much more
Bigger.
than the right, so that we did need to remove more
Mhm.
gland tissue from the left than the right. So they are looking much more even, and even you have swelling, and then close the garment again.
Perfect.
Okay.
No more puffy nipples.
And no more puppy nipples.
And the only incision is just this.
Oh.
Yeah.
Oh, that's so small.
Yeah, it's just this. You have small sutures on it. All
Right.
of them are absorbable,
Yeah.
and you will not need to remove them also, and they will be disappeared in a couple of weeks.
Absolutely.
Okay. I will change the strips. You may feel just a little bit cold because
Okay.
it's some kind of tissue bone.
Mm-hmm.
Invisible as possible. We will give you some more of these stuffs.
Thank
Okay.
you. Do I have to change it every day?
No,
Oh.
it's not needed. You need to change them when they are dirty or per 1 week time.
Oh, okay.
And you need to use them for 1 month time in order to keep the scar edge together, not
Right.
to get them wider.
Yeah.
And after the first month, you will need to use a scar gel.
Mhm.
Okay.
I'm allergic to silicone ones.
Okay, so you don't need to use.
Can I usually use tretinoin.
I will give you some recommendation, but
Okay.
we will need to use some kind of steroids.
Okay.
Okay, it's better than tretinoin.
Okay.
Okay. And the second one. Yeah, that's your all dressings. And I will put no more tapes. Yeah.
Okay, perfect.
So you will not feel anything, but you need to put this right like that.
Mm-hmm.
Yeah. If you need anything else, we will be always in touch. Your patient
Right.
coordinator will be pleased to answer your questions all the time. If not, we will make regular follow-ups
Right.
for the first few weeks, more frequently. For long term, it will be less, but our friendship will be forever.
Told you, you cannot get away from me. No way.
Okay. Do you have
Perfect.
any more questions?
No, I think I'm good.
Okay.
Yes.
Okay. Okay.
Perfect.
Okay. It was good to see you. Good to meet you.
I had a lovely experience.
Okay. Okay. Thank you. We are done.
Perfect.
Okay.
How was your survey, Matteo?
Okay, so this is actually not my first time here in Turkey, I'll let you know. This is my third, and I would say that this is the best treatment, one of the best that I've got. I was basically babied the whole entire time. So if you're scared of getting surgery, if you're not used to it, you're in the right hands. Because truly, whatever question you have, any concerns that you have, you can just text your patient coordinator and she'll reply to you right away. You'll be taken from place A to B punctually all the time. I noticed that some other clinics are like quite late with their schedules, whereas with this one, we were always on time. So that's one thing that I really appreciated. And overall, it went super smoothly, super caring. The whole entire staff at the hospital, at the clinic, the whole entire time. Even the hotel is super nice. Yeah, I'm very impressed. So, some advice that I can give to anyone who's maybe thinking of coming to Turkey. First of all, don't be afraid. The first time that I came here, not gonna lie, I was letting the voices that I've heard of Turkey around get it to my head. But as soon as I came, I was made super comfortable right away. The hospitals, so I'm in London. The hospitals here are way better, way more modern, cleaner. The staff is more punctual and more attentive to you. The nurses, some of them do speak English, so even if you're scared about not knowing the language, they will understand you. You can also use your phone for translating. There will be also a translator for you if you need it in that case. So the language shouldn't be a barrier. So another thing that I always hear a lot about people, like when I tell them that I go to Turkey to get plastic surgery, they're always like, okay, but you're in a different country. What happens when you come back? Like, and maybe there's a complication. That's very difficult that it's gonna happen, but either way, you have your patient coordinator with you at all times, so you can message them, and if there is a complication, you can always go to a GP back at home, so there's not really that much of an issue. Also, in terms of pain in general, I've had some painful surgeries. Not this one wasn't so much, but in the past I did, and they do give you quite strong medication, so you shouldn't be scared of pain either. And overall, again, they give you some extra medicines to also you can bring back at home. So you do have also all the aftercare that you can do by yourself at home. So it doesn't just stop after you leave the country, it continues back at home with you. So yeah, thank you so much Clinic-wise and to all the staff. It was such a lovely experience. I'll definitely be coming back in 3 months for other surgeries because I love it here.